Good morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
This video is sponsored by La Colombe Coffee here in Beverly Hills. We love La Colombe. We get it every day.
It's the best.
We're drinking the half tan, so it's half cold brew, half latte, and it's amazing. We got some cinnamon on top. How's yours?
The best. Thank you.
Mine is so good too. Today we're going to be talking about goal setting for 2025. 2025 sounds crazy.
I know. It's one of those odd years.
Yeah. Wow. We're like a quarter of the way till 2100. That's going to sound weird.
Wow.
That's really weird, huh?
Will we all be around? Maybe with AI?
You probably will be. you last forever.
Yeah.
With the new year often comes resolutions.
Yep. True.
Do you have any?
Yeah, I gotta probably put them to paper soon, but we always want to do more surgeries, help out more people. So that's definitely a goal, doing more surgeries. We love body lifts. We love helping patients achieve their goals after weight loss, as well as sort of letting the world know, silicone injections are bad. If you have silicone injections, get them out.
So those are work goals. What about personal?
Yeah, personal goals. I just finished my MBA, which is kind of exciting. So yay.
In what?
4 years. Social media marketing. So there's, MBA is a broad specialty, but you can now subspecialize your master's in, and I chose social media marketing, which I love, and I think is very, very important for whatever business you do. So we're going to look at other options. Cybersecurity looks kind of really interesting. We have a lot of patients.
For another MBA.
I'm not sure what the degree is in cybersecurity, but I think it's very, very important. All businesses can be threatened by cybersecurity.
Especially more and more every day.
More and more every day. Hospitals, businesses, large businesses, security businesses, and the threats are there all the time. So, always try to dual authenticate everything you have. Basically, just make sure everything you put on the internet, is free game. People can hack into it. So just be very careful, with your personal data.
Okay, so personal goal, maybe cybersecurity.
Yeah, maybe cybersecurity. We'll try to look into it. But again, social media marketing, we want to blow it up 2025. A lot more videos, a lot more educational stuff. So we'll see what we can do.
Yeah.
Yep.
So let's talk about some common cosmetic resolutions that people have for themselves.
Yeah, so a lot of the cosmetic resolutions would be to look younger. All right. Maybe you want to think about introductory stuff like maybe Botox or maybe some fillers. Maybe it's a little bit more advanced than that. Maybe you need a facelift or a mini facelift. Maybe you want to get rid of some extra fat with some liposuction. So those are kind of very common goals. Probably the most common procedure, liposuction, getting rid of extra fat that has been gained throughout the years, or maybe it's genetic fat. Or maybe, look, you've lost 100 pounds, 150 pounds, and you have a pocket of fat that you want to get rid of.
Well, it's estimated about 40% of Americans make New Year's resolutions, and 38% of them are weight loss.
Weight loss or weight related. Yeah. I think it's more. I think more than 40% of Americans make New Year's resolutions. Maybe those are just the people surveyed. These surveys,
Yeah.
Depends who you ask. Take them with a lot of grain of salt. But I think more patients or more people make a lot more resolutions. And I think more people than 30%, 35%, 40% make it weight related.
Right.
Yeah.
Yeah. Maybe they don't want to admit to it.
True.
Yeah.
So if you think of more than 50% of Americans are overweight, then if 50% are overweight, you'd imagine most of those people would make weight loss resolutions. So that's 50% of Americans, not 30% of 48%. My message to the world is, everything you eat or drink, just always say, is it worth it? Is it worth those extra 5 minutes on the elliptical or the bicycle? Or, is this worth not eating something else? It's a trade-off. It's a balance.
All right. What are key factors to consider when creating a timeline for plastic surgery?
Yeah, so I think that's very important. If you're a weight loss patient, I think it's very important for you to lose the weight. And then your weight should plateau for about 3 to 4 to maybe even 6 months, okay? But we want sort of a consistent weight. If your weight fluctuates maybe 3 to 5 pounds, that's okay. But if it's fluctuating like 20, 30, 40 pounds, those dips and valleys are too high, okay? So we need your weight to be stable. Once your weight is sort of stabilized or you're thinking it's pretty close to stabilization, consult with a bunch of plastic surgeons. I would suggest you meet with at least 5 plastic surgeons that specialize in the field of plastic surgery after massive weight loss, because not everyone specializes in this field. A lot of people sort of dabble in it a little bit, but you want to go to people that just do it all the time. Meet with many, see what they would advise in terms of staging of the surgery and what surgeries they would advise, and then go with your gut instinct. You know, we call it gestalt, what your gut says. I think that's very important, because you got to realize, you know, it's not just the surgery and the stuff we do in the operating room, it's also the post-operative care. So, you know, we see patients multiple times in the office, make sure they're all healed up and they've completed their journey.
With New Year's resolutions, do you see an influx of patients coming in for consultations?
Yeah, so with New Year's resolutions, we get a lot of patients, you know, even like January 2, boom, you know, they've made their wish.
They're already calling for January appointments, actually.
Yeah. So as January comes by, you know, they write down, you know, I want to get rid of this skin and fat once and for all. So they usually call our office. So January is usually very, very busy for us.
I think we're operating like for the first couple weeks on all Saturdays and Sundays too.
I'm happy. This one's not happy.
Let's talk about the consultation process. How long before someone wants their procedure? Say they want their procedure in January. How long before should they come in?
Yeah, for me, it really depends on your plastic surgeon. There are some plastic surgeons you can meet them and possibly even have surgery the next day.
Oh,
it really depends on the plastic surgeon. So what we do is we meet with the patient, and we learned this during COVID. I can do pretty efficient consultations over social media and virtual platforms, things like Skype, Zoom, FaceTime, and WhatsApp. We can see you, examine you, get a very good idea of what the procedure you need, get you out a quote as to what it would cost. Okay. Then we order the labs. Okay. You get those done usually about 2 weeks before the surgery. We make sure all your labs are good. We see you in the office once or twice before the surgery. And then we make sure that our virtual consultation correlates with the patient physically. Then we do our surgery, and then you do your recovery. And the recovery really depends on what procedures we're doing and if we're doing multiple stages, things like that.
Do you have issues, or have you ever had issues with it correlating from your virtual plan to in-person?
Yeah, really good question. And it's actually never happened.
Oh,
okay.
Wow.
So that means to say, you know, we see a patient virtually. We say, okay, you need a tummy tuck or a body lift or a thigh lift, etc. And then when we see the patient in the office, so far, 100% of the time, what we had seen virtually correlates with what surgery is needed.
Wow, that's impressive.
So, you know, we're pretty thorough. You know, during our virtual, we'll either have you send pictures ahead of time, which we can analyze, or during the virtual consultation, we'll examine areas with the video.
So rest assured, if you're doing a virtual consult, and these people do virtual consults from all over the world, right?
All over the world. So we've had, you know, Australia, Philippines, China, Japan, Germany, Scotland, England, Ireland, Spain, Italy, Dubai, Morocco, South Africa, all over Central America, Brazil, you know, Canada. Yeah. We've hit every continent except Antarctica.
Oh man!
So,
if anyone from Antarctica wants a free consultation,
we'll get you one. But we've hit all continents, which is kind of cool. And then, of course, all across the U.S.
Wow, there must be some days where if you had a globe, like you're talking to people from here.
So time is sort of irrelevant. You know, we're always open 24 hours a day because we got patients worldwide. So I kind of laugh. Sometimes we have some patients come in the office, and we always ask them where they're from. And they're like, oh, you know, it took me about 2 hours to get here. And it's only like maybe about 10 miles away because the traffic is so bad here in LA. They go, yeah, it's really far away. And I'm like, no, far away for us is places like Perth, Australia, which is like the western part of Australia, or like Dubai, you know, places like that, which are days away by plane. Yeah.
Oh my goodness. Yeah. So how can patients assess if a surgeon is the right fit for them?
Yeah, so I think it's very important for you to choose the right plastic surgeon. Don't choose the plastic surgeon based on finances, because one of the problems is if they're not experienced, you may spend a fortune in revisions, okay? So if the price is this and there are complications, you may spend a lot more correcting those complications because the plastic surgeon's not experienced. So experience is very, very important. Well, how do you assess experience? Well, I think the best way to assess experience is before and after pictures. So ask to see before and after pictures, ask to see as many before and after pictures as you can. That's why on our website we put hundreds of before and after pictures, not just one or two. So if your plastic surgeon says, oh, we don't put any pictures on the internet or doesn't have any pictures to back up the surgeries they do, you should think that's a little suspicious. Okay.
Yeah, I like that on your website you have some pictures that you could tell are like from 20 years ago when cameras first came out. But it shows how long you've been doing it, you know?
Okay. Hieroglyphics. No. It just shows, that we have a wealth of patients. Also, we get patients that come to the office. Dr. Katzen, you've never seen a patient like me before. You've never seen a body like me before. I've lost 102 pounds and here it is. And then I examine the patient and I'm like, nope, mentally that reminds me of this patient and this patient and this patient. And we can literally go to the website and pull up, 3 or 4 pictures that look exactly like that patient.
Right.
So they can get a visual of, oh, this patient had very similar anatomic features to myself, similar history, and got these amazing results. So I think that's very important for you to be able to see that the plastic surgeon's experience with the before and after pictures and can get you what you're looking for.
It also kind of gives that patient that's looking for a certain thing with a certain body type an idea of like the roadmap they can take to achieve that end result because they've already had all those procedures.
A lot of people think, oh, I'm the only person that's ever had this problem. And oh, the plastic surgeon's going to have to figure out a plan, a brand new plan, because this has never happened in the history of mankind. Well, yeah, it has. Here are multiple patients, multiple ways and paths to get there, but there is light at the end of the tunnel. We've done this before.
So how can patients set themselves up to afford these plastic surgery procedures?
Yeah, so to afford these plastic surgery procedures, there are a couple of different avenues you can go. One, you can try through insurance. Sometimes the insurance will cover part of the procedures. Sometimes all of the procedures, depends on the quality of your insurance. Then also, if you have to pay cash for it, as I say a lot of the times to my daughters, just do one step at a time. If it's a slow step, if it's a half step, if it's a quarter step, at least start that. So if you need to get X amount of money, every month save up a little bit. And if you can't save up that little bit, well, just save up a little bit less, and whatever these little attainable goals can be. And those little tiny steps over time add up. So just do little steps at a time. We also have a lot of companies that we deal with, Care Credit, Pop Recovery, and some other lending facilities, which will lend you the money, for these procedures. Also, if your credit is good, I always advise perhaps getting a credit card, which has 0% interest over a year, and then just conscientiously pay off that credit card in that year, so you wind up with 0% interest.
Oh, that's smart.
Yeah.
Okay.
Yeah.
And you can get points off of it.
Yeah, travel points, spending points, things like that.
Going into 2025, what do you project the most common procedures in America to be?
Crystal ball here. So based on trends in the past, I think liposuction will always be popular.
That's always number one, right?
Always number one.
Okay.
Multiple things can be done with the fat transfer to the buttock, the breast, throughout the face, the hands, etc., things like that. So liposuction, I think, will continue to be number one. I think we're going to be seeing a lot more skin tightening procedures because of the GLP-1s, Ozempic, tirzepatide, Zepbound, all those weight loss medications. You've already heard about Ozempic butt. You've always heard about Ozempic face. When you lose weight, you lose the fat, and the skin wrinkles because there's no longer that fat that's supporting it from underneath. So I think there are going to be a lot more tummy tucks, buttock lifts, maybe even body lifts, because we're getting rid of the skin and the fat from the tummy and the buttocks and the hips, lifting that area, and probably a lot more facelifts because people are losing more weight.
So studies indicate that individuals who undergo cosmetic procedures often experience improved self-esteem and body image. Do you see that a lot?
Absolutely, 100%. So we have a lot of patients come in, perhaps they've lost a lot of weight, and we do these procedures, tummy tucks, body lifts, thigh lifts, breast augmentation, breast lifts, arm lifts, facelift, things like that. And the positivity that we see after the surgery, patients are, extremely happy with their results. And you really see them shine through. We sometimes usually we're getting rid of a moderate to extreme amount of skin, but sometimes even by getting rid of a little bit of skin, that patient is just so much more confident. Self-confident, confident with themselves, more confident with others, social interaction. So it's really exciting.
We had two patients yesterday just show us their pictures and like
Mhm.
new clothes that they bought and
Yep.
these beautiful dresses.
Yep.
And they were like, we were never able to wear this
Yep.
before. Look at us now.
Yep.
So it is exciting to see.
Or maybe they've had clothes in the closet since high school that they've never been able to wear since high school, and they're back in those. We get common stories of, well, I'm dating now again. We have a lot of patients who, not necessarily because of my surgery, but because of their self-confidence,
Right.
now get engaged and married and have children.
Uh-huh.
So it's a wonderful thing to see. People send us postcards. Oh, this is my baby, and this is what I look like. This is my wedding pictures, and we're like, wow, that's really cool.
Yeah. And it really is like the confidence that they carry with
Mhm.
their how they feel because and they even say like I got a whole new wardrobe, I'm going out more, I'm doing
Yep.
this, that.
Yep.
So it is really neat. I can understand
Yeah.
why, excess skin for some people will hold them back
Yeah.
because it's you can't find as many clothes that fit you really well. Like our
Yeah.
patient yesterday was saying it's frustrating because he was shopping for wedding clothes
Mhm.
and he said nothing fit him right and he was having to tuck his like extra stomach in and
Yep.
stuff, and it was just he said that's exactly why he wants it all gone.
Yep, absolutely. So, yeah, and it's also a reminder of the past where you sort of came from being overweight. So often we get from weight loss patients, I lost the weight and I was told to lose the weight for many, many reasons, but no one told me about all this extra skin that would develop. And a lot of patients sort of hit that weight loss, develop that extra skin, and then they're like, I really don't like this extra skin, and then go back a little bit to being a little bit overweight to fill in that skin.
Yeah.
So that's not good. So we always advocate, lose the weight, get rid of as much weight as you can, and then stage 2, get rid of that extra skin.
Yeah, and we've also seen some opposite where like the patient lost a little too much weight and like if people told them they kind of look like a skeleton and then so they had to gain maybe 10 more pounds.
True.
And now they're in a nice spot.
True.
So speaking of the trends in plastic surgery, approximately 60% of patients report being influenced by social media when choosing their cosmetic or plastic surgery procedures. Do you think that's about right?
I think it's more.
I think it would be more like
90.
90.
Yeah, I think it really depends on the patient. Maybe the older generation, maybe we trust word of mouth better. Maybe word of mouth from friends, maybe word of mouth from your previous surgeon, maybe your bariatric surgeon, things like that, or maybe even your private medical doctor. I think the newer generation immediately gravitates to the internet. Okay. So, but I think the younger generation are more influenced by social trends and influencers, things like that.
And what they see.
And what they see in terms of, body physique and maybe procedures they've had. A lot of entertainers and celebrities are very open about procedures, and that opens up the doors really for plastic surgery procedures.
I think, yeah, for a lot of people that are on social media, you can't help but see all these like beautiful, curvy people online.
Yeah, absolutely.
And you look at them and you're like, how is their waist so tiny? Their butt so big.
Yeah.
And it just constantly is influencing you, whether you even realize it or not.
Yeah.
Especially when your friends or people around you are like, wow, look at this person. This is the perfect person. I think a lot of people are like, wow, like what could I do to look a little more like that?
True. I think we're becoming a much more visual society, especially with these social media platforms.
Yeah, and I think the percentage that doesn't, get influenced by that, maybe they, like you said, it's word of mouth, or they have a friend or family member or, that points something out to them, or maybe they're just unhappy with how something hangs on their body or looks to them,
True. But usually, inevitably, even if it's a referral by word of mouth, they're going to want to see pictures before and afters to show what is achievable with these procedures.
Yeah. And then also, I think one of the main things probably is people know what they used to look like.
True.
And let's talk about long-term maintenance. How do we maintain these plastic surgery results that we invested so much into? Yeah,
so I think it's very important for you to take care of your results that we can create surgically. So it's very important for you to exercise, maintain your current weight, eating right, high protein, low carbs, minimal sugar, no alcohol kind of diet. I think those are very important. Also, sun causes a lot of radiation damage, elasticity to the skin. So you want to be pretty careful with the sun too.
Do you stay out of the sun?
No, but that's my choice. Yeah, love the sun.
Do most of your patients maintain their results long term?
I think so. We get constant postcards. We bump into them sometimes 20, 25 years after their surgeries and say, wow, you look fantastic still after all these years. And yeah, they look great. Because a lot of people, invest a lot of time in these procedures, a lot of finances into these procedures. So it's an investment, sort of like a car, and you want to maintain that appearance as long as you can.
Yeah, and I think after your procedures, particularly, it makes it easier for people to work out
Yeah.
or live an active lifestyle.
Absolutely. So a lot of patients have these procedures so they can work out better, which is really cool too.
Awesome. Now, can you help us set some goals for 2025? What is your advice to people when
Yeah,
setting goals?
so I would figure out what you want to do, what you want to get out of life.
Mhm.
Okay, so what do you want to do? All right, and then just write those down. I think there's a lot of power in writing things down.
Mhm.
Sometimes people think about it, la 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 la, and then the next day, what did you think about? Well, I don't remember. But if you write it down, that's one act to sort of get it done. And then once you write your list down, get really specific on the list. So if you want to lose weight, okay, then figure out, well, how are you going to lose weight? Well, I'm going to eat better. Well, how are you going to eat better? Well, I'm going to eat more protein. Well, how much protein are you going to eat? Well, I'm going to eat 70 grams of protein a day. Okay. Are you going to do that in 1 meal, 2 meals, 3 meals? Are you going to do intermittent fasting? Really zero in on your goals. And then once you have that outlined, then you're good to go for that year. But don't just ethereally go, yeah, I want to lose some weight. Yeah, I want to make some more money. Just write them down objectively. How are you going to do that? Come up with a very, very specific game plan.
Okay.
And, try to do it on your own, but there's some very powerful tools out there like ChatGPT. You can dial in there, how to lose 10 pounds, all printed out. How to make more money. It's all in there. Mm-hmm. So the tools are literally at your fingertips and it's free.
Yeah.
Yeah. Pretty amazing. So use the tools.
Use the tools, make your 2025 goals, and leave your goals down in the comments below. We would love to hear them.
Yep.
And if you have cosmetic goals, you can leave them down in the comments too. And if you're interested in 2025 scheduling a consultation with Dr. Katzen,
give me a call.
Give us a call, comment below, or DM us on Instagram at Dr. KatzenMD, and we'll get back to you with a consultation.
Yep.
All right.
Or you can give me a call, 310-859-7770.
So thank you guys for being here for our 2025 goals podcast.
Yep.
And we'll see you next week.
We'll see you later on next year.
Bye-bye.
Thanks. Cheers.